going to work on this class 1 to start with, just to show you the flow. And I'm going to correct that bend just a little bit. So I'm going to take the ACTIVA, I'm going to place the cannula into the deepest component and part of the tooth and slowly allow the material to come out of the cannula into the preparation. And I'm going to keep the material in the cannula together. I'm going to apply about a millimeter or so of the material, and as I remove the cannula, so I kind of dragged it across the cavo surface so that this way I didn't pull the material straight out. With an Explorer or a microtip brush, you're going to just go into the material and gently make sure that you have it in all of the various areas to the line angles. And again, as you're manipulating it, make sure to pull up on the material onto the walls of the preparation. You're also going to allow the material to set in the tooth for approximately 20 seconds before curing. That enables the interface between the tooth and the ACTIVA material to kind of become greater. And we have been finding that that also helps to reduce any kind of air voids that you may consider having. You won't have air voids with ACTIVA if you apply it in this way. After you've left it on the tooth for approximately 20 seconds, you then have a 20-second cure. And during that 20-second cure, you're trying to make sure that you do not overheat the tooth as well. If you are using a very high energy light curing unit, set it to normal cure in 20 seconds. Heat dissipation in any and every composite material injures the tooth structure. You do not want to overheat teeth while you're placing composite. It will damage the dentin and the nerve. So now we have the internal aspect of the restoration completely cured. We can now bulk fill the material the rest of the way. So again, material is coming out of the cannula and I'm leaving the tip in the material and I'm gently flowing it. You can bring it all the way up to the cavo surface margin. And it's a gentle backflow. You see I just kind of routinely move it up onto the cavo surface. Again, with your Explorer, you can gently tease the edges up onto the inclines. And once you've got that done, let it sit for a few moments. Again, don't be in a rush. One of the biggest things in traditional composite restorations, we rush through everything. We have found that if you take your time and go ahead and cure accordingly, you're going to get a great restoration with great adaptation and a fabulous result for your patients. If you don't cure for 20 seconds, even though this material is dual curing, you only give it a 5-second cure or something less, and expect it to be fully polymerized throughout, you probably will have a problem because the material won't be fully set and you'll create some challenges, especially in the deeper portions on a class 2 or class 3 restoration. So you want to make sure that you don't under cure as well. So 20 seconds is the optimal. And now we have a very nice interface. Now the really neat part about these blue models is they're rubberized. So I can now take out the restoration and show you how this is now formed internally. So we've got a nice solid restoration top to bottom that actually conforms to the preparation there. And it's already very solid. Can't really do much to break that apart. Taking that kind of a step-by-step approach can help you create a very nice, long-lasting, bioactive restoration.